All right. Hello and good afternoon, everyone. I'm hoping that everyone can hear and see me. I am unable to see myself, but I hope that you can see me. My name is Elizabeth Henriquez. It is my sincere pleasure to talk to you today about tennis elbow and the unique role that hand therapy can play in its treatment. Chronic pain is a serious issue and it truly impacts one's overall well-being. Quality of life is something we certainly are all trying to improve, especially in the midst of this pandemic. So I want to thank you for making an investment in your health, deciding to listen into this webinar today. I would also like to take the opportunity to tell you a little bit about myself. I am an occupational therapist. I am also a certified hand therapist. I specialize in upper extremity rehabilitation. I have several years of experience treating all kinds of conditions from the shoulder all the way to the fingertip. Here at Mercer-Bucks Orthopedics, I am part of a wonderful team of hand therapists that work really closely with the surgeons, the 3 upper extremity surgeons on staff to provide comprehensive patient-centered care. I also want you to know that patient education is truly my passion. I am very passionate about educating my patients, especially at that first visit, the initial evaluation, which we'll discuss a little bit further in the slides. I believe that if patients feel as if they know what's going on with their bodies or even have an inkling as to what their specific problem is, they are then empowered to do something about it. They can change it. There's no such thing as silly questions or too many questions. If I don't have the answer, I will try to get the answer for you, or I will defer you to someone who has the answer. So without further ado, let's talk about tennis elbow. So how is everyone? Do you have tennis elbow? Are you experiencing any of these symptoms? Do you think that you may have it? Do you have pain when you're carrying bags of groceries or cases of beverages? Do you have pain when you're opening jars? Do you have pain or tenderness on the outside of your elbow here? Do you have pain when you're carrying your laptop, doing your laundry on the outside of your elbow? If you do, you just may have tennis elbow. Now, the literal term, the formal diagnosis, what you would see in your chart, if you were to take a look at it, or what you would see on a script for therapy, the literal term for tennis elbow is lateral epicondylitis. Lateral epicondylitis is also known in the literature as lateral epicondylosis. I feel that lateral epicondylosis, that term, better depicts some of the patients that I see in the clinic. By the time patients have come to see me in the clinic, they have progressed from a more acute inflammatory phase into more of a degenerative phase or status. So I'll talk a little bit more about that later on. So you're probably wondering, Liz, I don't play tennis. I am not a tennis player. Why do I have tennis elbow? And that's a very good question. So a very small percentage of people who have tennis elbow actually play tennis recreationally or competitively. A much larger group of non-players is affected with tennis elbow. This is because tennis elbow is literally an overuse injury. Wear and tear affects the muscle tendon units, and the muscle tendon units are essentially, everywhere in your body. So this can occur anywhere in our bodies and in any individual. So you don't have to be a professional tennis player like this gentleman here. So let's delve a little bit deeper into what tennis elbow is. As I mentioned to you before, the literature describes tennis elbow as an overuse injury to the tendon. In this picture, we are looking at this arm. We are looking up at the dorsal or back part of this person's forearm, right arm. You'll notice a teal marking on the muscle here and the specific muscle tendon unit that we're going to be talking about today. Extensor carpi radialis brevis, also known as ECRB. This muscle here, I'm going to try to, just in case you guys can't see it, I'm going to use my mouse here. This muscle here runs alongside of a collection of other muscles that, as you notice, feed into the wrist and also the fingers. So this muscle helps to bring your wrist back, and it also helps to bring your fingers back. So here we have our helping hand or arm again, but we can take a closer look. Your elbow joint in itself is comprised of 3 joints. Here you have your humerus, this is the end part of your humerus, and then here and here you have the 2 bones in your forearm, your radius and your ulna. So for my visual and or kinesthetic learners like myself, it may be helpful for us to even go a little bit deeper and identify some of these landmarks on the body and also on the picture. So here you have your lateral epicondyle. If you feel on the outside of your elbow, you may feel a little pointy ridge. More than likely that's your lateral epicondyle, hence the term lateral epicondylitis. Here is a closer look as to what specifically is going on. So we have bone, we have tendon, we have muscle. Here's our problem, here's our pathology, here is the root. This is why you have pain. So if you notice here, there are micro tears at the tendon origin site. The micro tears are caused by cumulative trauma that occurs to the entire muscle tendon unit. By clinical definition, you should have point-specific tenderness when you point on that outside of that elbow, that pointy area, when the doctor presses on it, or when I press on it when you come into the clinic to see me for therapy. A lot of the patients that I see, by the time they come to see me, they are under the wonderful influence umbrella of either injections, if they decided to receive one, or oral anti-inflammatories. So by the time they see me, they may or may not have that point-specific tenderness. So I don't want you to get too worried or consumed if you don't have that right about now. But by definition, you touch there, you say, ouch, it's tennis elbow. We take a history, we learn about your occupation and other things that you may be participating in. That's tennis elbow. What exactly does cumulative trauma look like? Cumulative trauma looks like your everyday activities. Some of these things you may have done just before watching this presentation and joining us. Some of these things you may be planning to do afterwards. So your everyday activities, pretty much, our cumulative trauma comprises your everyday activities. All of these activities here may be brief, you may be participating in them for a brief moment of time or longer durations, but they all have one thing in common. And they all assist in furthering to insult and inflame an area that is truly just trying to heal. Your elbow's trying to heal itself, but we need to live our lives. We need to take care of our children. We need to go grocery shopping. We need to drive to work. We need to drive to family. We need to take care of our homes. We need to work. We need to take care of ourselves, but the area is trying to heal. So how can you make it stop? The thing you want to do is stop the painful activities, your participation in these painful activities. It may be hard to do, and rest looks different for everyone, depending on what you do, what your responsibilities are. We all have lives, as I mentioned to you before. So the beautiful thing about working with a therapist, working with someone like myself, we have the skills to create what rest looks like for you, given your circumstances, your life, your responsibilities. But if at all possible, it would be a good idea for you to really truly stop those painful activities. The next thing you want to do is seek medical attention. You want to come in and see a doctor. Any of the doctors here at Mercer-Bucks Orthopedics can take a look at your elbow and really confirm your suspicions. Because as I mentioned to you before, you went to Dr. Google, you went to Dr. YouTube, you think you have tennis elbow, but you just want to confirm, you really want to have someone who has that background confirm what you think is going on with your elbow. Okay, so you do that. The doctor says, hey, I think you benefit from a course of therapy. You then attend occupational therapy, come see a certified hand therapist like myself, if medically appropriate. Now, oftentimes there may be a wait in between the time in which you see the doctor, receive the prescription for therapy, and the time that it takes for you to get in to see the therapist, especially for that first visit, that initial one-on-one visit. So you may be wondering, Liz, how do I take care of this now? I need to feel better now. I need to do something now. So if you look here on the bottom, I have two things. These are two products that I really recommend as far as assisting in reducing your pain. I also have to add a disclaimer. I am not in any way, although I wish I was, being paid by Futuro or the other company here for this Healbo pad on the bottom left-hand corner of your screen. I am not being compensated in any way. These are just products that I like to recommend to my patients, and I find really help to provide the support. So if you look here on the bottom left, the Healbo pad. The Healbo pad provides warmth, compression. That warmth and compression then reflects back to your tissue, and it helps improve blood flow. In short, in summary, it feels good, so wear it. Another feature of this Healbo pad that I like is the fact that it has a nice cushion that you can move on either side. So we're here today, we're talking about tennis elbow, so that's on this side of the elbow. But there's also golfer's elbow, medial epicondylitis, that's on this side of the elbow. So this pad you can kind of move to either side to help give you some support. Now, also, if you tend to find yourself sleeping on that side, that could reduce blood flow to that area. So if you have a cushion like that, that'll help reduce some of the pressure. So the Healbo pads are something that I recommend. To the right, you'll see a Futuro splint. Now, this is a wrist immobilization splint. You may be also wondering now, Elizabeth, you mentioned before that this is tennis elbow. The problem is at our elbow. Why are you recommending for something to block my wrist? So, as I mentioned before, with the mechanics and the anatomy of what we have going on with this condition, although the pathology itself is occurring at the elbow, the actions that occur at the wrist, the repetitive wrist extension, the repetitive gripping, impact the health of the tendon and impact the health of your elbow. So if we immobilize, keep your wrist nice and straight, prevent you from bending your wrist back, especially when you're typing for long periods of time, when you're working at home, we then allow those wrist extensors to rest. Now, what's the wearing schedule look like? Could be different for everyone, but I typically recommend in the beginning for you to wear it at least at night. If your pain level is 6 and up, so 6, 7, 8, 9, 10, 10 is emergency room, 1's a whisper. If you're in that 6 to 10 range, you really probably should be wearing it for the most part of the day. But at minimum, wear it at night so that you can get some rest, so you can get some relief. Also, I want to mention that for the wrist splints, I am not a fan of the neoprene for this condition. The neoprene has its benefits. However, I like a more rigid splint for this because you want to have that support. You don't want to be able to force your wrist into that bent position because the purpose is to give your wrist a break. I also like Futuro because they have some features. They have some splints that are made specifically for men, splints that are made specifically for women. So that's another reason why I like Futuro. If you notice here, I do not have a forearm strap on this slide. Now, it's not because I forgot it. I intentionally left it out. I am personally not a fan of the forearm strap, also known as the epicondylar strap. Now, the purpose of a strap like this is to really offset or take the load off of the muscles and help redistribute the forces through the entire muscle, thus reducing your pain. I am not a fan of the epicondylar straps because sometimes they can aggravate your symptoms and it's hard to tell, especially in the beginning. people who may have tennis elbow and something we call radial tunnel, it will increase your pain. So I'm not a fan of the strap. Stick to the pad, compression sleeve. If you like copper fit, put copper fit on your elbow. But these are the two things I think you can do in the interim before you come and see one of us. So what does occupational hand therapy look like? What are we going to be doing? So you get your referral, you get your script. You would come in for that first visit, which would be one-on-one, where we would do an extensive evaluation. We would evaluate your range of motion, your pain levels, your strength, and we would determine where you lie along the continuum and how to best reduce your pain and improve your functioning. Using that information from the evaluation, we create a customized, personalized treatment plan, a plan of care, and we would go from there. In general, I typically see my patients, I wouldn't see someone for more than 2 months for this condition. Of those visits, you'd probably come maybe twice a week, and the visit duration would be anywhere from 45 minutes to 1 hour. After 2 months of therapy, I personally refer, at that point, we kind of take a look at the objective data, see where your grip strength lies, see how well you're able to participate in your activities of daily living. And if you do not have, full resolution of your symptoms, or if you don't, basically, if you're not making progress, I'm going to refer you back to the physician so you can determine what other options you may have at this point. Another thing I want to talk about as far as hand therapy, for me personally, tissue irritability helps to guide the progression of your therapy. And this is sometimes frustrating for patients because there is this no pain, no gain kind of a mentality with certain conditions in therapy. And for tennis elbow, that is not the case. If tissues are a little bit more irritable, there are certain things we shouldn't be doing. The great thing about tennis elbow, I know I'm saying a lot of things that are not good, but the great thing about tennis elbow is that tissue irritability is something that you are feeling in yourself. So this is something that will help you to manage it on your own, especially if you catch this early on enough. This will help you in the long run. So therapy, what are we doing? The R word is not on here. The R word meaning rest. Because rest looks different for everyone, as I mentioned to you before, and we'll discuss that when you come in and we do an evaluation and we take a history. But I talked to you about the bracing. There are different types of braces that you can use. Exercises, eccentrics, concentrics. There are different types of exercises that we're going to run through. There's also a portion in which we will be getting our hands on you using different treatment modalities, whether it be instrument-assisted soft tissue massage, whether we actually use the Graston. We also can make recommendations as far as your work site, whether it be at home or the office. We know that that is directly related to the health of your elbow, how you're positioned, how long you're positioned in certain areas, basically how your workspace affects your body and your elbow. Also, activity analysis, behavior modification. I talked to you before about this, how your therapist can truly sit down with you and talk about you, your life, what's going on with you, and how we can help to change some of the things. We can also further down the line discuss return to sport and play and how to best do that. We also utilize kinesiotaping and all sorts of other physical agent modalities. I will mention also that there is often the thought that if I just get the laser, if I just get iontophoresis, or if I just get ultrasound, if I just get these things, that's all I need and I will get better. Research has supported the idea that physical agent modalities, while they're great, they are temporary. And they truly should not be used in isolation. They have not been effective. it's not effective to use these things and not be doing the exercise, not be modifying your activities, not be doing all the other sorts of things to advance your healing. Now, the most important reason why you should probably see a hand therapist, certified hand therapist like myself, is the personalization and the customized treatment plan that you can receive. So if you Google tennis elbow, Dr. Google will give you exercises. Dr. YouTube will give you exercises. And they may not be bad exercises for tennis elbow, but it may not be the appropriate time for you to complete those exercises or participate in those exercises based on your tissue irritability, based on you. So Dr. Google, Dr. YouTube, they cannot provide specific exercises that are appropriate for you based on the present levels of tissue irritability and other factors that we would evaluate at your initial evaluation. So how can you make it stop? One of the things we discussed previously is the wonderful tool of activity modification. So in general, these are the things tennis elbow likes, and these are the things tennis elbow doesn't like. So let's say yes to reaching with the palms or thumbs up. Let's say yes to stepping closer to the objects that we are interacting with. Let's say yes to keeping your elbows bent. I just want to give you a visual here. So when you reach for a heavy gallon of milk, your muscle tendon unit here, that teal in that collection of muscles that we talked about earlier, has to withstand 1, the weight, the force of gravity, 2, the actual weight of the extremity, and 3, the gallon of milk. So that is far too much for a muscle tendon unit that is trying to heal. So that's a gallon of milk. And now anyone who may be listening that lifts weights or participates in any other kinds of activities, just think about that for a second. A gallon of milk is too much. And of course, this is all temporary. I want to keep that, I want for us to keep that in mind, that these things are temporarily, just as you're trying to get yourself to a level in which your pain is managed. So over to the right, let's say, as far as activity modification, let's say no temporarily to having your palms down or wrists flexed when you're reaching for things, reaching for heavy objects or high objects without a step stool. Let's also say no to participating in activities temporarily where one holds grip or pinch for long durations. So what about the actual tennis players? The small percentage of you who may be listening who actually play tennis. So you may be wondering, when can I get back on the court? Couple things you want to consider. So your current status is the first thing you want to consider. If you are still in pain, you probably should not be playing. And of course, this means if you're still in pain after you've successfully completed therapy, you got your graduation t-shirt from us, yay, we sang, we danced, we had fun. You're done with all that, but you still have pain, you probably shouldn't be playing. And if you successfully completed therapy, you feel great, it is my general recommendation that you try to build your level of playing over a period of 4 weeks to really assess how you're feeling. You don't want to go 100 miles per hour immediately once you start feeling better. Another thing you want to consider is your technique. So for increased control, less stress, and strength demands on the arm, you want to bring your body closer to the ball. You want to take advantage, and this is with lots of sports, not just tennis. You really want to take advantage of the strength in your lower body, your core, your shoulders, your upper back to address the ball. Next thing you want to consider is your equipment. There is a plethora of equipment options now on the market that really will help you get back on the court and keep you in the court. They have different types of rackets, all sorts of things. Finally, I want to add that a lot of my patients often develop tennis elbow in the other arm after successful resolution, whether it be on their own or with the assistance of therapy. They get tennis elbow in the other arm. This happens all the time. Do not let this discourage you. The beautiful thing about there are many beautiful things about therapy. I know I've been saying that a lot, but another great thing about therapy and participating in therapy is that you will have the tools to manage the tennis elbow on your own. The next time you start to feel those sharp twinges on your elbow, you can immediately govern yourself accordingly. You can break out your heat, break out your ice, break out your massage tools, break out your stretches, start to modify your activities. You can do everything that worked the first time in order to get your pain levels down on your own. Other things you may also want to consider I've listed here is rest. I want to take a hard pause because rest is a powerful, 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 wonderful thing. As a mother of three, under three, I can testify to the damaging effects of not getting enough sleep. Your body needs rest. Whether your tissues are healthy, whether your tissues aren't healthy, rest is imperative. It won't hurt to take a break from your cell phone. It won't hurt to take a break from the Netflix and to give your body some rest so it can heal. You also want to be sure to participate in a general aerobic exercise program, something that gets your heart rate up, something that contributes to your overall, improving your overall blood flow in your body, bringing those healthy cells back to that area, to that elbow, to really put your best foot forward. Next thing you may want to consider is your nutrition. I'm not a nutritionist, by all means, I don't have that background, but we do know that certain types of activities, smoking, for an example, is bad for your tendons and bad for tendon healing. That goes along with vasoconstrictors. Vasoconstrictors are things that kind of close the blood vessels. And also we discussed breaking up repetitive tasks. So all of these things, all of these pieces will help to contribute to, in reality, one's overall health and wellness. And that is something that truly is invaluable nowadays, your health, your wellness. So I want to thank you all for listening in, and I wish you all a happy Friday. I also want to thank Jen for suggesting this topic. I hope that this information was helpful for you, and I'm going to pass it off to her now.
Hi, Elizabeth. Thank you. Great presentation. It does appear that you do have some questions in the Q&A. Are you able to see the Q&A?
Oh, yes. Here we go. Okay.
Great.
I see a few here. Here is the first question. The question reads, my pain is on the inside of my elbow. Is that the same or different? Good question. So more than likely, again, I want to stress that it is a good idea for you to come in and see a physician to get a formal evaluation. But more than likely, if you have pain on the inside of your elbow joint, that is something different. That more than likely could be golfer's elbow. But there are also other structures that lie on the inside of the elbow. You've got other types of soft tissue, but you may in fact have golfer's elbow, which is also known as medial epicondylitis. Is that the same? No. In a sense, it is the same in the sense that it is an overuse injury, but it's an overuse injury to the opposite side of the elbow and those collection of muscles. So same, but different. I hope that answers your question. Thank you for attending. We have another question here. The question reads, can you spell the name of the elbow pad product? Is it Healbo? That is exactly what it is. Capital H-E-E-L-B-O. So you can drop the W. And I literally just Googled it. You can get it off of Amazon. I don't believe there are any places that you can get it like off the shelf, but it's definitely on Amazon. So thank you for your question. Thank you for attending. The next question reads, does squeezing a softball help? So that is a no. That is my answer to that. So squeezing a softball does not help. It is something, grip strengthening is an important part of your rehabilitation. But as I mentioned to you before, if your tissues are already in very irritable state, squeezing a softball repetitively will actually further inflame that area. So we kind of need to see where you are and determine whether that would be an appropriate exercise at that time for you. So it will help, but we don't know whether it'll help you at this time. It can really harm you. So thank you for your question. Thank you for attending. The next question here is, are some people more predisposed to tennis elbow? Good question. What the literature tells us is that there are a couple things that we see. So I believe it's anywhere from individuals aged 35 to 55 that we typically see tennis elbow being more prevalent in. Male or female, I believe that might be equally distributed. Me personally, within my clinical experience, I have lots of patients who have jobs where they are working very hard and they are manual laborers. They have to put a lot of stress on their bodies, on their elbows in order to work. So I know your occupation can cause you to be a bit more likely to develop tennis elbow. There are other things, I don't want to delve into it too much, but I know that there's information about how some people may be just more prone to inflammatory-like conditions. But again, that is not my background. I'm not a physician, so I would defer to them for that. But I hope I answered your question. Thank you for attending. The next question here is, it reads, how do you wrap the tape to support the tendon? Oh, I'm hoping that you are referring to kinesio tape. Am I correct? Let me check the chat to see if you put something on here. Okay, so I'll go back to the question. How do you wrap the tape to support the tendon? So there are specific techniques that you would use, but there are lots of different techniques. Kinesio tape in itself, you really want to have someone who's has the clinical skills, the technical skills to apply it, because there is a certain degree or percentage of tension that needs to be applied. Your wrist needs to be in a certain position during the application of the tape. So coming into therapy, we could do it for you. And this is usually what I do. I do it a couple times for my patients, helps them feel good. And you want to determine whether it's something that's going to help you first, right? So it helps them, then I teach them how to do it. I'd either, we'd video myself applying it to the patient, and then they can try to tape themselves. It's a little difficult being one-handed, or they can get a family member to tape them. So there are wide techniques, there are other types of methods, but your therapist could guide you as to how to best support that muscle tendon unit. Very good question. The next question we have here, also, yes, thank you for that question. Thank you for attending. The next question we have here is, can overuse and a sprain be treated the same? So when I think of sprain, I think of a direct injury or insult, a specific episode, something that we can pinpoint. When I think of overuse, I think of, as I mentioned to you before, that cumulative trauma, a little bit of this, a little bit of A, a little bit of B, a little bit of C, equals overuse. So as far as therapy goes, without having a specific diagnosis, there probably could be treated the same. Yes, there could be because we're essentially still addressing the symptoms of the sprain, the symptoms of the overuse. However, with the sprain, if it's soft tissue, there are specific parameters that we must follow as far as healing, and there are specific things that need to be introduced as far as treatment in specific times. So in the general umbrella of treatment, yes, but that's not a cut and dry answer. I hope I answered that question. Thank you for attending. So the next question is, if there is any pain, should ice or heat be applied immediately? Also, what painkillers are better, ibuprofen or paracetamol or acetaminophen? Good question. So if you have pain, and again, it is not an acute injury, you didn't fall, you weren't in a car accident or anything like that. It is specifically related to tennis elbow, especially after listening to this presentation. Your hunch, your suspicions are confirmed that it may be tennis elbow. I would recommend initially probably using ice in the beginning. You can use heat in the morning. That's what I typically tell my patients, especially if you have stiffness or pain. Often people with tennis elbow in the morning, they say their elbow feels very, very stiff, almost kind of like it locks. So I would typically recommend using heat in the morning before you get your day going, and then ice at night. Ice, you can use a ice pack that you put in the microwave. I'm sorry, not microwave. Those gel packs, sometimes you can put them in the microwave, and you can also put them in the freezer. So you could do that, provide like a circumferential ice massage. You can also take a Dixie cup, fill it with water, put it in the freezer, take it out, take the first centimeter off the edge, leave that exposed, and do like circular massages to the outside of your elbow. What painkillers are better? It is not within my scope of practice as a therapist to recommend medication, so I'm going to defer you to your doctor. Your doctor would determine what painkillers are better, what's the best for you given your history. Okay, the next question is, does this affect the nerves in the inner forearm? So this, specifically tennis elbow, is just a mechanical issue, muscle, tendons, musculoskeletal issue. It does not typically include or affect the nerves of the inner forearm. There are conditions that tend to coexist or occur alongside of tennis elbow that do in fact affect the nerves that run through the forearm. The next question reads, should tennis players proactively wear the heel bow or use elbow wraps or kinesio taping to prevent tennis elbow from developing? Very good question. So you don't necessarily need to do that. If you are living a healthy lifestyle, you don't have any muscular imbalances, you're feeling fine, there's no need for you to, in my professional opinion, there's no need for you to wear the heel bow or use the tennis wraps or the kinesio taping. These are treatment techniques, modalities, supportive tools that we use to relieve some type of pain or strain on the muscle. So the goal with therapy is to eventually wean from those things, because you weren't born out of it. You didn't come out of your mother's womb wearing straps and braces and things like that. So the goal is for you not to need to wear those things. That's my philosophy, my professional opinion. Again, others may differ. Thank you for your question. Thank you for participating. The next question reads, oh yes, kinesio tape from elbow up toward the shoulder. Okay, so this sounds like this is a follow-up question to the question above where it was asked, how do you wrap the tape to support the tendon? So yes, you wouldn't go from the elbow up toward the shoulder. When you come in for therapy, we could give you the specific techniques as to how to apply it and how much tension and what direction. But thank you for clarifying. It's good. We know that we're on the same page. We're both talking about kinesio tape. Okay, and looks like the last question we have here, it reads, do you have an opinion on acupuncture? So that's also a good question. I know that there is a lot of evidence and support for the use of acupuncture. I personally have not come across of any literature that supports or states that acupuncture is a verifiable or evidence-based treatment, effective treatment for tennis elbow. So while it may be effective for other conditions, in my opinion, I have not come across anything in the literature that supports it for helping to improve tennis elbow. Not saying that it doesn't, but I don't believe the evidence supports it at the moment. So I hope I answered your question. Thank you for your question and thank you for attending.
Hi, Elizabeth. You do have just a couple of comments in the chat section. Should we hold playing tennis until completely pain-free, or is it okay to start with minimal pain?
So that's a tricky one. I personally, if you have minimal pain and you continue to play tennis, depending on how often you're playing tennis, how long you're playing tennis, more than likely you're just perpetuating that cycle of pain. So even minimal pain is a signal that your body is telling you that something is wrong with the elbow and the health of that tendon. So you can do it, but is it recommended? No, I wouldn't recommend it.
Okay, great. I think you answered everything. Thank you so much for your time. We appreciate you taking the time to discuss this information with us. It was very thorough and informative. So thank you again. For anyone who is on this and you have any additional questions, please feel free to reach out at programs@mbortho.com. Those emails come directly to me, and then I can always consult with Elizabeth to get your question answered for you. If you would like to schedule an appointment, please go ahead and call 855-896-0444, or you can go to our appointment request on our website at www.mbortho.com. Sorry for some of the technical difficulties. We were having trouble at the beginning forwarding the slides. For some reason, we knew that may be an issue. And then, of course, I forgot to mention it at the beginning of the webinar. So thanks for sticking with us and being patient. And we are going to hope that you enjoy your upcoming weekend, and we look forward to seeing you next time. Thanks, everyone.